Well, good afternoon. This morning, I spoke with Dr. Solomon of the Israeli Ministry of Health and Galet Baram, the Consul General of Israel in Toronto. We can learn a lot as a province and in a country from their success in rolling out COVID-19 vaccines. Predictable supply of vaccines is critical. On Friday, the federal government notified us that Ontario would receive no deliveries of Pfizer doses this week. And we've been told to expect a smaller amount the following week. In response, our officials have worked around the clock, doing the math and crunching numbers. We're accelerating vaccinations from our most vulnerable seniors and those who take care of them. We're running well ahead of schedule. 10 public health regions have finished their first round of vaccinations in their long-term care homes. I've asked General Hillier and the team to complete all long-term care homes and high-risk retirement homes province-wide by February 5th instead of February 15th. As we speed up vaccines for the most vulnerable, we have to ensure we're able to deliver their second dose. If the past week has taught us anything, it's that we can't take vaccine shipments for granted. I want to be clear. We're using every single vaccine we can to protect our most vulnerable. But delivery delays are now forcing us to be careful and cautious as we plan to ensure we're able to offer second doses. That means reserving second doses and vaccines for frail and vulnerable long-term care home residents who need as much protection as these vaccines can offer by receiving both doses within 21 to 27 days. As soon as there's certainty in deliveries, as soon as we can start receiving regular shipments of vaccines from the federal government, it'll be full steam ahead. My friends, we are ready. We have the capacity to vaccinate nearly 40,000 people per day, and we're working to triple that capacity pending federal government supply. It's our hope that by the summer, everyone who wants a vaccine will be able to get a vaccine. We have the best team in the entire country working on the rollout, and they're working around the clock. Until a vaccine is widely available, please stay home, continue following the public health guidelines, and together we will get through this. Thank you, and God bless the people of Ontario. Now I'll pass it over to General Hillier.
Premier, thank you. And ladies and gentlemen, we are going to be short lots of vaccines over the next week from what we had anticipated getting. However, we should not despair. We are going to continue to roll out the vaccination program across Ontario. And as the Premier stated, we are going to focus it very precisely on those who live in most vulnerable circumstances. And that means those long-term care homes right across Ontario and our high-risk retirement homes. Right now across the province, we have vaccinated almost 300,000 people, and out of that, more than 50,000 have received their second needles and so have completed the immunization program. We've done almost 80% of those long-term care homes with a first visit to get the first needle in arms, and we are going to make sure that we have the second dose so they can get the second needle and, of course, complete their immunization program also, because we want to ensure that they get the highest level of protection that we can offer them. We've completed somewhere around 550 out of 775 retirement homes with the first visit to ensure that at least the residents, sometimes the residents and their staff who work there and the essential caregivers and the healthcare workers who look after them have received that first needle and that first vaccination also, because we want to offer them the same kind of protection. So we continue to roll out the vaccination program across Ontario. Our capacity is immense, and I just want to take a second and just compliment and thank the medical officers of health across the province, the CEOs of the hospitals and their teams, and then the teams that have been supporting them from the Ministry of Health and Solicitor General to roll out the vaccination program, because ramping up really quickly to get those eye capacity flow-throughs was an incredible act, and then having to put the brakes on it and slow down and refocus somewhat, and then be prepared to ramp up again as soon as we get more vaccines is not an easy thing to do. It's an enormous planning capability, planning requirement, and it requires leadership to make it happen. And those are the people who've been making it happen, and they are incredible. And I know that the people of Ontario hold them a huge vote of thanks, and they don't even know who most of them are. So I would want to say thanks to them. We're rolling the program out. We're going to get the long-term care homes done as soon as possible. We could do it sooner than 5 February. However, we actually are dependent upon some vaccines arriving next week to complete those homes. And we'll do the retirement homes across Ontario, the rest of them, as quickly as we can after that. And we will be ready with the increased capacity when more vaccines arrive in later February and throughout March. Thank you.
We'll go to the phone line for questions. First question, please.
Your first question comes from Ashley Legasic with News Talk 1010. Please go ahead.
Hi, Ashley.
Hi there. Thank you for taking my questions.
Thank you.
Premier, the latest inspection report from Roberta Place in Barrie is incredibly concerning. Residents were not being properly isolated. Staff were caring for COVID positive and COVID negative patients. So many protocols weren't being followed. So, Premier, people are dying. Why haven't you asked the military to come in, and will you?
Well, we've asked the Red Cross that have been in there. That's the support we needed. When I asked that question, I was told I should say that we don't need them, and I'll pass this over to the Minister of Health.
Well, there is support that's coming in addition to whatever support Red Cross can offer, but the Royal Victoria Hospital as well as Soldiers Memorial Hospital have been helping out because we now have an association between long-term care homes and hospitals that they're able to deploy personnel, bring in PPE, whatever else is necessary. And we've also had some vaccines go into this particular long-term care home to the residents that are able to receive them.
Follow-up? Ashley, do you have a follow-up?
Hi, sorry, can you hear me now?
Yep. Yes, we can.
Yes, thank you. Sorry. My next question is for Premier Ford and for Minister Elliott, and it's about vaccine hesitancy among healthcare workers. Does the province have numbers on how many healthcare workers have refused to get a vaccine? And if workers do refuse the shot, will they be allowed to work in high-risk settings like long-term care homes?
Well, I understand they may be hesitant, but our goal is to make sure we get as many people right across the province, frontline healthcare workers and otherwise, vaccinated. It's absolutely critical, but I can appreciate their concerns. In saying that, I encourage all frontline healthcare workers to get vaccinated. It's absolutely critical. And I encourage all long-term care, PSWs, frontline healthcare workers there, caregivers, please get vaccinated. Again, it's absolutely critical. And you go back to any long-term care home and Roberta long-term care home, you go down to root cause. Root cause, we have the UK variant in there. We need to tighten up the borders. As I've been saying over and over and over again, go to root cause on anything. So we could have possibly caught them at the airport. And I encourage all long-term care homes, 626 of them, test all staff, all caregivers when you go into long-term care. And there's no exceptions. Again, I always focus on root cause. I'll pass this over to the Minister of Health.
Well, we know that there has been vaccine hesitancy on part of healthcare workers as well as the general public. But it was interesting in speaking with Dr. Salman from Israel earlier today. He indicated they had a much higher vaccine hesitancy rate than they anticipated. But as soon as they started out with their mass vaccination campaign and people could see that there were no ill effects, and then that vaccine hesitancy rate diminished quite quickly. And I anticipate that's what's going to happen in Ontario as well. For those people that are hesitating just because they're concerned about side effects or just don't know whether they should take it or not, most people in Ontario are anxious to receive the vaccine. And I expect that once we receive the larger quantities and start the mass vaccination clinics, people's attitudes will change.
And I also, just to add to that, you know, we're waiting in line. Everyone at this table right now will get vaccinated. But that's just to reassure the people.
Next question.
Your next question comes from James Jackson with Waterloo Region Record. Please go ahead.
Hi, Premier. Could you comment on a Waterloo Region church called Trinity Bible Chapel? It continues to host in-person worship twice on Sundays without mass, and MPP Randy Hillier actually attended this past Sunday. Just hoping to get a comment on places like this that continue to host in-person events or services despite the lockdown and in opposition to the lockdown.
Yeah, but I understand places of worship are very, very important. Other places of worship have gone online. They've actually had more people, viewing and going to services online than they had prior. What I've been told, and I think it's careless and irresponsible for them to host, especially in the situation we're in right now. And Waterloo numbers I've seen jump up before, so I'd really encourage them not to do this. They aren't being responsible whatsoever. So I discourage this 100%.
Follow up?
Is the province considering, cracking down even more on these types of places, where local police or local regional governments, seem unwilling or unable to crack down? Is the province considering stepping in and doing more, I guess?
I'll pass that to the Solicitor General.
Thank you for the question. As the Premier often says, all options are on the table. But at the end of the day, when organizations and individuals put the rest of our community at risk by traveling to a region that is in outbreak or having these gatherings that lead to, frankly, some pretty disturbing outbreaks, it puts all of us at risk. So I hope that the vast majority of people will continue to do the right thing, and that is, of course, stay home, stay safe, and save lives.
Next question.
Your next question comes from Nicole Lampa with CTV News Kitchener. Please go ahead.
Hi, Nicole.
Hi, Premier. Thanks for my call. And this is a follow-up in regards to what was just asked, because there was a court order for the church to comply, because they are currently facing more than $1 million in fines if convicted. So there was an order for them to comply to the Reopening Act or risk being in contempt of court, and yet they still held the two in-person gatherings yesterday. The police chief just spoke, said charges are pending. But what more can you do? Because there were, between 300 to 600 people there yesterday, and, are you willing to explore shutting them down before their court date?
Well, again, they have to be responsible. I'm so disappointed that people would go there, and I understand how important places of worship are, but they have to lead by example. They're community leaders in right across Ontario places of worship, and I just encourage them, please don't continue doing this, and there will be consequences. So I'll pass this back to the Solicitor General.
Thank you. So as you mentioned, we are working with our colleagues over at the Ministry of Attorney General on the injunction piece. And again, I will reinforce, community leaders need to lead, and that includes our faith leaders. And the vast majority have been able to pivot and provide those critically important faith-based services to their parishioners, to their faith followers. And I would urge this church in particular to do the right thing and make those changes so that they can continue to serve the people that they want to help, but keep the rest of the community safe. Thank you.
Follow up?
This is a question for my colleagues in Toronto. Roberta Place, why were the Moderna vaccines redirected from the long-term care home? Who made that decision and why?
General, do you want that, or Soljan?
I can take it.
Okay.
I'm not sure of what you speak here about redirecting Moderna vaccines from the long-term care facilities. We put an emphasis from the start here on the long-term care facilities in the 4 regions of Toronto, Peel, York, and Windsor-Essex, because that was the most threatened. That's where most of the ravages had taken place. We wanted to complete that, and we focused on it, including with the allocations of vaccines. And now that we've completed that, and many of the retirement homes in the area. We're now focused on the rest of Ontario, and as I said, we're 80% complete doing the long-term care homes around the rest of Ontario, and we want to complete that as soon as possible. Given the arrival of vaccines early next week, we should be able to complete it by next Friday, and soon after that, complete the retirement homes around Ontario also. So we've been doing it in a staged manner, a phased operation to get at those who are at most risk, and if vaccines moved around, that would have been why.
Next question.
Your next question comes from Laura Stone with the Globe and Mail. Please go ahead.
Hi, Laura.
Hi there. General Hillier, this is probably for you. It's just regarding the strategy of who you are going to vaccinate first. I mean, the government's new line today is you're going to prioritize long-term care residents and high-risk retirement home residents. Why wasn't that the emphasis from the start? And do you think if you'd only done residents in these settings that you could have completed them by now and perhaps saved a lot of people who are now dying in some of these homes?
Well, Laura, what I would say is we have done what we could with the characteristics of the vaccines that we have. So early on we had Pfizer, which meant we could not get to the residents of those long-term care homes. So what we chose to do was to get as many of their essential caregivers, their staff, and their healthcare workers to work with them, because obviously that's the vehicle by which most times COVID-19 enters those homes. So we felt, and the medical officer's advice was this, that you could give them a huge level of protection by simply vaccinating the staff who could come to where the Pfizer was, because initially we could not move the Pfizer. Then when we got the ability to move Pfizer, plus we also received Moderna, we had sufficient vaccines in the pipelines, we believed, to do all the long-term care residents and the staff in the homes and provide them that complete package of protection. And that's what we launched out to do, and that's what we still would want to do. The change is because we don't have enough vaccines, and that was a surprise to us, as you know.
Follow-up?
And there is a report regarding when Pfizer changed its protocol to move vaccines into homes on December 18th. Ontario did not do that until January 5th, it seems. Can you just explain the timeline and why it took so long to get Pfizer into the homes?
Well, we actually worked through the timeline with Pfizer to get the protocols established to make sure we could actually do that without diminishing the capacity of the vaccine. And so we started earlier in January moving Pfizer. At the same time, then we received the Moderna. So we did it fairly quickly, quite frankly. And we did it by getting the protocols right so that we would not diminish the effectiveness of the vaccine. And we also wouldn't have any wastage, because it is a very, I don't know, if I could put it this way, a very fragile vaccine once you thaw it and dilute it. And then you only have a very short time to use it. So we wanted to be comfortable. We had it right as soon as we were, and a lot of people were working hard at that. As soon as we were, we started moving it and started using it for residents also.
Last question.
Your final question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Rob.
Hi, everyone. Excuse me, sorry. This might be more for Minister Elliott. We heard a number in a briefing earlier today that I wonder if you could expand upon. It was a gentleman from the long-term care ministry who said, and if I heard him correctly, that 3,000 long-term care residents have not consented to having vaccinations for COVID-19. So is that flat-out refusals, or is that a number that includes people who, because of perhaps medical allergies or other reasons, are not, really prime candidates for the vaccine?
Well, that would include the people that have refused. It may include people where they may not be able to give their own consent, where they need to be in touch with their attorney, and they might not have been able to access that attorney yet, or there may be other conditions. But for the most part, it's a very small number of residents who are in that situation. Most residents have been very anxious to receive the vaccine, and that we've had very good success with the take-up in our long-term care homes.
Follow-up?
Okay, thank you, Minister. And just on the UK variant and the other variants, so we've seen what's happening in the Barrie nursing home. The medical officer there suspects that most people in there actually have the variant, UK variant. Now we have the Bradford example. There's a few others. How much do you fear we are flying blind on these variants, given the length of time it takes to do the genomic sequencing And what are you going to do to fix that?
Well, we are doing a lot of testing right now. We've done over 9,000 samples to determine what variants we're dealing with, and we've done 3,000 since the beginning of January. And as of next week, we're going to be able to do 1,500 per week in order to understand what variant we're dealing with, where it's the UK, the South African, or the Brazilian. So we are we're much on top of it, and we are detecting it very quickly so that we'll know how to deal with different geographic areas where it may show up.
And Rob, further to that, you know, again, you go to root cause, and I had a good conversation with the Prime Minister, I believe on Thursday, and I can't stress this enough. We have to test every person that comes in to Pearson and any other crossing, land crossing. It's absolutely critical. You know, we need to put barriers up every which way we can. I also encourage the Prime Minister, close down any travel coming into Canada outside of residents of Canada or citizens of Canada. There's no reason we need people coming in. You know, up in Etobicoke North, we're not far from the airport, and I see these planes flying in, one after the other after the other. And every time I look up in the sky, I'm thinking, how many cases are coming in? This has to stop. It's absolutely critical. I have confidence in the federal government that they will make sure we have mandatory testing, but we need it now. We need to get set up. We're set up there. I'll be at the airport tomorrow, so I can't emphasize enough. Close down our borders and make sure anyone that's coming in gets tested. Mandatory testing. You know, you're looking at a rate of, let's say, 30,000 international travelers that are coming in. And the positivity rate on the tests that we're doing, and this is voluntary tests, is 2.5%. So if I'm doing my math correctly, 2.5% of 30,000, 750 people slipping in through the border that have COVID. I just don't get it. Let's make this happen. Should have made it happen, honestly, months ago. But again, please, let's make sure that we test every single person that comes into our country, rather than having 750 people fly into Pearson that are positive. Just doesn't make sense whatsoever. So we look forward to working with the federal government, and I know they're listening, and they're going to do everything they can. But we need to go quick, vite, as they say. Thank you.
Thanks, everyone.